Hi, my name is David Emerson. I'm a long-term multiple myeloma survivor, myeloma coach, and director of People Beating Cancer. Welcome to the vlog post about, in general, chemotherapy side effects. Short, long-term, late-stage side effects. I'm not using this vlog post to mention anything specific, any therapies to prevent or reduce side effects. I'm simply talking about side effects in general. It's critical for myeloma patients and survivors to understand that side effects can really harm you beyond the physical pain, a short-term side effect like nausea, losing your hair, a longer-term side effect like peripheral neuropathy, nerve damage. Yes, those side effects are painful and problematic. The challenge is they can really get in the way of your chemotherapy or your conventional therapies working. 9 times out of 10, the usual response from your oncologist, if you have, let's say for argument's sake, nerve damage, is to reduce the dose of your chemo. Or perhaps you'll take a vacation, take a week or two off to improve your nerve damage or see if it goes away. That messes up your therapy plan. That's bad. So to understand short, long-term, late-stage side effects, to anticipate them, perhaps supplement, eat, perhaps prevent them or reduce them, I think is the best way to go. I think conventional oncology has always done a poor job of preparing the patient for the possibility of side effects. I get that your oncologist doesn't talk about it much because, let's face it, no one would undergo chemotherapy or radiation if they truly understood the risks involved with short, long-term, and late-stage side effects. However, side effects, I think, are a double-edged sword. For instance, I developed heart damage about 15 years after my high-dose, both autologous stem cell transplant and induction therapy. Research shows that I could have reduced or prevented it by supplementing with CoQ10, curcumin, several supplements. I think that understanding side effects, anticipating them, and heading them off at the pass is the right way to go. Your oncologist probably doesn't agree with me on that point. If you are curious, let's discuss it. Scroll down the page, send me a question, comment. I will reply to you ASAP. And by side effects, I'm talking about everything from short-term side effects, alopecia, hair, nausea, losing weight, or not being able to, you don't feel hungry, so you don't eat. Long-term side effects might be cataracts. I developed cataracts. That surgery to fix them is actually fairly straightforward these days. Kyphoplasty for your spine, that's an important therapy to manage spine problems. As I said, CoQ10 to minimize or prevent heart damage. There are a host of therapies and non-conventional therapies to potentially reduce or prevent side effects. That's the point of this vlog post. If you're curious, send me an email. Let's discuss it. In the meantime, hang in there. Be well.